Hello, everyone. We are live with an expert OBGYN from Italy, Dr. Ferrazzi, and I'm going to get right into asking him all your questions. But before we start, he has been working nonstop. As you know, Italy has been hit hard with COVID-19. So I really want to appreciate him spending this time with me, as I'm sure he's exhausted and so tired. So, Dr. Ferrazzi, can you tell us a little bit about yourself?
Well, I'm a professor in Obstetrics and Gynaecology. My main field of expertise is fetal maternal medicine. And at the moment, I'm chairing this unit of obstetrics downtown Milano. It is the single largest unit in northern Italy. We deliver 6,000 babies per year. So we have a large department and 42 beds of intensive neonatal care. So it's a large unit. So when our region decided to draw a ring of COVID maternity hubs for all hospitals to send in patients positive for COVID, Mangiagalli, my hospital, is one of the largest in these 6 maternity hubs for COVID positive mothers. So far, we started this network 20 days ago. And the first case we had in Italy, as you probably can remember, was February the 21st. And it was a single patient coming from Germany. Okay, so in Milano, we have 300,000 Chinese people, and Milano is not yet hit. So the region which was hit first in Lombardy is what we call the automotive area of Lombardy. Okay, it's connection with Germany. So, and the RNA of the virus we have is the RNA that came from China through Bavaria into Italy. So when the first case was evident, hundreds of people had already been infected by the virus. And so doctors were treating pneumonia, different kind of pneumonia. They didn't know what it was. And then eventually we understood it was COVID-19 syndrome. Okay, so that's the big picture. And unfortunately, you will probably see the numbers. And today, again, we had 600 people died. And the average age of death is 80 years old. Wow. Lombardy has a huge old population, and overall in Italy we have 3 million people older than 75 out of 60 million people. So mainly in the north of Italy. So, and these people is suffering most because in adult males especially it's very severe. So let's say that first of all, males and females, they get sick with the same prevalence, but the severity of the disease is 70% male, 30% female. First step. And second step is pregnancy. Pregnant women appears to be less affected by severe forms. So we just submitted to the Journal of American Medical Association the first experience of these 20 days, and we submitted 42 cases. All went well, and not a single baby was affected by delivery, either cesarean section or vaginal delivery, 50-50, 50 cesarean, 50 vaginal. 3 were infected in postpartum period. Okay, so we don't know if it was breastfeeding or other personnel, people transmitting the infection. And out of these 42 cases, we had only 4 women who necessitated mechanical respiration. But again, in adult and in adult males, it takes usually 10, 12 days if they overcome the severity of the respiratory syndrome to leave the mechanical assistance and move to less intensive care. And these women, it took just 8 hours, 1 day to leave the mechanical respiration. So women are protected, pregnancy is protecting. So you can leave your pregnancy knowing that this virus is not transmitted via the placenta to the fetus, and it is not transmitted by vaginal delivery. And if the symptoms are mild, we recommend breastfeeding because the virus is not in the milk of the mother, and the milk of the mother has the antibodies additionally protecting the newborn. So that's a kind of chain of little good news from males to female, young female, pregnant women, newborns.
So in the women who had it, when they're breastfeeding, they didn't, I guess, have to wear a mask or?
Yes, of course. Nowadays, we usually deliver in a way that we call, kind of natural delivery. The baby is skin to skin, hugged by the mother with the cord still pulsating. We don't clamp the cord immediately. So this is the picture nowadays until 2 weeks ago. Now we do not allow skin to skin, or even for healthy mothers, because we know that some healthy mothers might be asymptomatic, but still being infected. So in labor and delivery, even healthy mothers have to wear masks, and even the companion has to wear a mask. And the midwife, during labor, wears just a mask to protect herself. But during the pushing period, when if the mother is infected and asymptomatic, there is a lot of virus coming out of her mouth. So during the second stage, during pushing, the midwife will wear glasses, a special coat, gloves, of course, and a hat to protect herself. Because, of course, we have to protect, healthcare providers who every day are facing new patients. We deliver 14 cases, 15 cases per day, so we need to protect ourselves for asymptomatic carriers.
How did these patients get tested? Did they actually have symptoms, or are you guys testing? Because I know we have a problem here. We don't have enough tests.
The policy of our government, our region until yesterday, was to test only symptomatic people. So what we had to do at the beginning was to have a pre-triage at the entrance of the hospital, so that suspected women, just cough or fever of, just coryza, just cold, wet nose, they were suspect. Okay, so they have the samples, the nasal throat sample, and until we don't know the results, 6 hours, 4 hours, they wait in a special area. And if they're negative, then go to the normal labor and delivery. If they are positive, we have 3 special labor and delivery rooms with the air coming in and not out of the room, so that if there is a virus inside, it's not going out when you open the door. Okay, so it's a negative pressure rooms. Okay, and so then we have 300 women coming every day for obstetric care. And again, we have a pre-triage for these women, and a suspect for symptoms or being in contact with someone who is known to be ill. Then we have to send them to special outpatient facilities where people is wearing, protective garments to protect them. So the problem is not the severity, except for some rare cases. The problem is how to reorganize the pre-triage, the triage, the admission, the ward, the delivery. So it takes a lot of efforts. And this is happening in hospital where until 20 days ago, we had 150 intensive care beds for adults. Now we have 400. So we have closed cardiology, we've closed pneumology, we've closed emergency medicine, we've closed our gynecological surgical rooms to make room for intensive care units.
Okay.
So that's occurring in major big hospitals in Lombardy, and now we are making 400 beds in the fair area of Milano.
Okay.
Okay, so to allocate people.
If a patient is pregnant and they were considering doing a home birth, I don't know in Italy if they do, midwives go to home birth, or if there are centers and they have symptoms, you are advising them that they should come to and have a hospital birth, correct? Is that
Yes,
safer?
I would advise them to come to the hospital because we had cases occurring in the postpartum period.
Right.
You know that after delivery of the placenta, the estrogens goes down,
Yes.
okay? That's the origin of the blues after delivery, okay?
Right.
So it might be that a woman is protected until when she had the placenta and the estrogens, and 1, 2, 3 days after, they have symptoms and they prove they are symptomatic. So, but in that way, they pass the virus to the baby. And again, the newborn is protected. There are no severe cases known, but exceptions might occur, and so being prudent is a strong recommendation in these cases.
I know we don't have a lot of research yet. This is so new. We don't have as many. 42 is probably the largest. I've seen the China ones were 9 and then another 10.
Yes.
How do you see this virus differently than the other coronaviruses? Because I know that SARS and MERS, there were increased risk of miscarriages and stillbirths, right? So how is this one? It seems like it's not as bad as we thought, or
the problem for COVID-19, for SARS-CoV-2, like for MERS and SARS, is that we know from MERS and SARS that these viruses do not cross the placenta, but the severity of the disease in pregnancy was such severe cases. So the termination of pregnancy, premature delivery, miscarriage was caused not by the virus into the placenta, but was caused by the maternal disease, which is not the case for this virus.
What makes a virus cross the placenta or not, or go into breast milk or not? I don't know the pathophysiology. I mean, how are viruses different in the way they enter? I know this one has that S spike that goes into the ACE2. And I know in the pregnancy, we become more Th2 dominant, right? The cytokines are, and maybe that is the protective.
Right.
Do we know anything about, how this will affect these children later on in life? Can you speculate and say, children who were exposed to this virus, is it just like the flu, the H1N1? Is it just like they now have immunity to it, and in a way their immune system might be stronger? What are your thoughts? I know we don't have research on that. But
let's start. You asked many questions. So let's start from the first question. And the first question, the key point is the famous spike. Okay, it is. Well, let's call this spike 19 or COV2. Okay, so the problem is the virus, they change continuously, randomly. Okay, so in this case, this virus changing randomly developed a part of the virus who was producing a protein, and this protein is like a hook who is able to attach not only to the nose and the throat, but is able to go down and attach to the lung. Right. It's like a hook, a new hook, because coronavirus is a virus of the common cold. Yes. Okay. This is a mutated coronavirus, which is not attaching only the cells of the nose and the throat, but also the cells of the lungs. And this is a terrible mutation that occurred somewhere, somehow in a bat and moved to humans, and then here we are.
Right, right.
Okay, this is the first part of the question.
Yeah.
The second part, if this hook is not able to attach to your hand, is not able to attach also to your placenta. So it just pass by, and then it's like a bottle in the sea. Is not attaching to any rock, any cliff. It just bouncing back to and through, but it's not attaching. It's not invading the cell. It's not entering the cell.
Right. I know I did a post all excited for my moms who were pregnant that this isn't going to pass. And then some people sent me a few, I guess, case studies where the infants did have this virus pass. What makes the placenta, I guess, more permeable, or like how do some people not have it pass through, but those few that do, what is the difference, I guess, or most people want to do, is there something they can do to prevent that? And I don't think there is, but in your opinion,
You
is
mean to
there?
prevent becoming sick?
No, let's say that the mom has it, is a carrier. Is
Yes.
there anything they can do to prevent that from passing on? I know most of them don't, but I know there have been a few cases where.
So far, since this virus is similar to SARS and MERS, we know that these viruses do not pass the placenta.
Okay.
Don't.
Okay.
So don't worry about that.
Don't worry. So they
And
don't need to
now
worry about.
we are collecting, we are on top of about 60 or whatever, I don't remember exactly the name, many cases in which we sample the vaginal secretions.
Yes.
We're checking if the virus is in the vaginal secretion. It doesn't look like that. So since this virus in some cases can be found in the GI tract,
Yes.
it might be that there is a contamination of the perineum
Mm-hmm.
and not the vagina.
I see.
Okay?
Yes.
So that's what we are guessing, and we are starting that
makes
right now.
sense. So for those who are trying to conceive,
Yes.
many are asking me and are worried.
Fantastic, fantastic, because you're sheltered at home, you have nothing to do but read and look at the television and then make love with your partner. That's perfect.
So in
So
your
we hope
opinion,
we
this
can
is not a.
increase
Okay, because that's what I've been telling patients. But I guess if someone is trying naturally, I'm saying to go ahead and there's no increased risk. But I know here in the Reproductive Association, they have advised against embryo transfers, IVF, all of those have stopped. How is it in Italy?
We have stopped that, but we have stopped that for a reason, for a different reasons. We need nurses, we need doctors to move from one area to the other. We need nurses for the high intensive care units. So we stopped that for not for any problem with transmission of the virus. This is not transmitted sexually.
Okay.
This is not transmitted by the sperm, neither by the oocytes. So this is not a problem.
Okay, great. So if you know your husband tested positive, you don't need to be worried that now is not the time to conceive, that this can get passed on.
Yeah, if your partner is tested positive, it's better you sleep in different beds, different room, different bathroom, and you avoid to become infected, because when we talk of big numbers, we say that women are least affected.
Yes.
We have very few young women died because of this virus, but it's not zero. Mm-hmm. So if your partner is infected, you better go back to your home somewhere else, or live in different places, use different bathrooms, and so on and so forth. Because of course, numbers are numbers, but 1 in 100 means that someone will die of that.
Right.
So I don't want to be that one. Okay,
yes.
That's the recommendation.
In those 42 cases that tested positive in your study, did they have any autoimmune disease in the past, or any kind of predisposing issues that made their symptoms different? Does that mean every pregnant female get a fever with this?
Not as far as we can understand. So they are normal women, like conceiving normally and having a normal pregnancy until when they get sick. And just to describe you, one patient was 35 weeks of gestation, and she was in the COVID ward, okay, not in labor, and she developed suddenly this severe dyspnea, the respiratory difficulty.
Yes.
And so we decided, since it was 35 weeks of gestation, we decided to deliver by cesarean section and avoid additional complications. She was moved to the intensive care unit, and in 8 hours she came back.
Wow.
Okay? Just 8 hours to overcome this crisis, but she was at home. We don't know what was going to happen. And another case was 28 weeks of gestation, the first pregnancy. She was in the COVID-19 ward, and she was feeling feverish, not severe, 37.8. And with a difficult to breathe, and the saturation went down to 92%. The oxygen saturation of the blood usually is 97, 98. So the oxygen saturation went down to 90, 92, and the heart rate of the baby went up to 200 because of the poor oxygen. So the baby was had to compensate. So we immediately intervened with high oxygen flow. And so we established 95, 96, 97 oxygen saturation, and the fetal heart rate went down. It stayed like that for 6 hours, wasn't during the night. So at the early morning, everything was settled, and she's still doing fine. She's pregnant, and she's going on with her pregnancy. So the reason why we recommend to check with your maternity as soon as you have symptoms is that it might happen. It's rare, but it might happen that something needs to be treated all of a sudden to avoid additional complications.
I have a good question here from an attendee who's asking that we often hear that pregnant females and elderly are at risk as they are immunocompromised and that they need the flu shot with influenza. How is it that this is different? So how is this different? Are you seeing that women should be getting their flu shot and this actually helps with COVID-19? Is there any correlation?
No, there's no correlation between these two viruses because in Italy this year we started we promoted a campaign for H1N1 flu preventive vaccination.
Yes.
So I think in Milan we reached 70% of pregnant women, okay? So because last year we had severe cases of H1N1 pregnant women who underwent intensive care units treatment for days, okay? Because H1N1 is very severe for pregnant women. And it is completely different. So there is no relationship between the two.
Okay.
So vaccinate for H1N1 because it is a much worse problem for pregnancy.
So right now in Italy, you're not having any shortage of surgical care for women who need C-sections for...
No, not at all. No, because one of the first statement that our healthcare authorities said that pregnancy must be protected whatever the epidemic. So we have the maternity outpatient facilities working as usual with the pre-triage, as I told you, to separate possibly infected women, but they're working as business as usual.
Yes. Okay. And are you having any blood tests come out in Italy? The IgM, IgGs, has that rolled out yet?
No, we're not using it.
We're
just sampling for CR positive or negative.
Yeah, no. I know. I was listening to an infectious disease doctor here in the university, and they said we still don't know how long the IgGs will last. And my question is this similar to like the Epstein-Barr virus where it can reactivate? Is this a virus that, like in many other, can be dormant, like a herpes virus, and then it can reactivate again? I mean, do we know that? Is this something that if someone has, they're okay for the rest of their life if they're asymptomatic?
I must admit that to the better of my understanding, nobody has a real answer to this question. We hope that next summer, next autumn, it will not come back. And if it comes back, population is protected, okay, by the immune system, but we don't know.
Okay. So breastfeeding, you said everyone should continue. There's benefit
what
to that.
I recommend if you're living in an area with a high prevalence of the disease like New York, if you're healthy, please breastfeed with the surgical mask.
Okay.
Because you might be infected, totally asymptomatic, but you might be infected.
Right, right. Many people want to know, so in Italy, why do you think it's been so bad? Is it just because you think the population is older in that region? Or, I mean, I was looking at the death rates and it can't be right. It was closer to 10% and it's around 1%.
Yes, but again, until yesterday, okay, the average, the median age, not the average, but the median. Okay, it's a little bit different. But anyway, let's say the average age is 80 years old.
Yes.
Unfortunately, we are losing a whole generation.
Right.
Okay, because we are up now to like 5,000 people who died. You know, it's not that much in the 10 million people population, but when you see the military track taking the coffins to transform them into ashes, it's a real sad.
I'm sure. I can imagine. So the data, I guess, is not.
The worst thing is that if your beloved one is admitted in IQ, you can see
Yes.
the ashes coming back. He leaves home, he dies, and you see ashes.
I can see this has been so difficult. What a caring doctor. Have you lost anyone in that you know through this personally?
I have friends who survived. Okay, so we were really scared because some doctors were infected, but they were treated and they survived. What you should understand is that one cause is age. Okay, the second cause is that, of course, intensive care unit require a lot of staffing. Okay, and if you're tired, it might be that 5% of this might occur because really these people is overstressed.
Yes.
And so, you know, you can't blame them.
Yeah.
And what we really felt like a real cultural pain was that when all this started in Lombardy, we did not receive any single syringe, any single mask, either from Europe or the United States or whatever. And that was a really bad feeling, like we were, you know, something to forget about. Now that the thing is happening everywhere, people is understanding how it was difficult for us to stand against all on our own. Okay, so we didn't have mask for all people because Germany, France, and other states, they forbid to export to Italy surgical masks. And it was really, for us, it was really astonishing to receive cargoes from China bringing masks to us and doctors from Cuba, instead of receiving doctors from Sweden or from United States. So that was really, you know, striking the vision that that the population had of the alliance between Europe and United States and, you know, these countries. So for us, it was really, you know, if it were a war, we are already being conquered, and nobody was taking care of what was going to happen in our country.
So is this a political thing that's been, I mean, I don't want to get into politics or anything right now, but this was a shock for the Italians? Like it was an actual surprise?
It was a shock that nobody was helping until 7 days ago.
Oh my gosh.
Yeah.
Yeah, I've had patients or doctors from New York, they're writing to us all asking, they run out of gowns, they run out of masks.
I think it's the same is happening in the United States. I think that each one should help because this is moving, okay? If it is concentrating in New York, the doctors going there and helping, then New York will pass over and you send doctors other places because you leave people alone, they can't stand the amount of people entering hospitals and all as if it were a normal business. No, it's not normal. It's so terrible that you can't really stand it on your own. You need to feel you are a real country, not separate federal states. Yeah.
Was there a lot of implementation of the social distancing and the government? Did they close everything pretty quickly and tell everyone to stay home like they are here? Or how is it?
This is a condition that's been discussed and criticized, but we are not a totalitarian state. So in China, when they realized there was a big problem, they said people must stay home. The army was in the street. Nobody was moving. Okay. from the beginning, let's say 15 days delay, but nobody knew what was going to happen. So we can criticize, but anyway, 15 days delay, okay. In Italy, when we had just 10 little villages with red zones, if the prime minister was saying, we lock down all Italy, they would say, you're mad, I'm not staying at home.
Right.
Because it's just 10 villages of 20,000 people and all Italy is locked down, 60 million people, you're mad, you're not the prime minister. So we had to, unfortunately, to wait until people understand really what was going on, to lock down and keep social distancing and whatever. And you know, the funny thing is that in Milano, we are 3 million people, more or less. And we have a Chinese community of almost 300,000 Chinese people, okay? So they immediately shelter themselves. So we don't have Chinese people in Milano, okay? So this is fun. You should know that the most common family name in Milano is not Colombo, like Smith in the United States, okay? But it's Han.
Oh,
the most
really?
common name in Milan is Han.
Oh my gosh, I had no idea.
It's not Smith, okay?
Wow.
So this is fun. So Milano so far has been partially saved by the so this is so different from Madrid. Madrid is, but another condition that should be considered is that in January and February, Lombardy suffered of the worst climate terms of high temperature, no wind, and concentration of nitrogen dioxide and carbon dioxide. And if you look at the thermal space photograph of Lombardy in January and February, they overlap with the same color they had in Wuhan in December and January.
Oh, wow.
So it might be that the lungs of all people had been exposed for 2 months to these microparticles and these venoms caused by pollution.
Yeah. People are asking me if dietary-wise or supplement-wise, vitamin D, vitamin C, their prenatals for pregnancy or trying to conceive, or anyone in that matter, has Italy or have you seen anything that you're recommending to help the immune system or to help as antivirals?
No, we usually recommend a good portion of vegetables, fruit, fish, nuts, eggs, and few.
No pizza? No pasta?
No, pasta is anti-integral. You know, just 3 or 4 times per week, not more than that. Red rice, not white rice, because red is anti-diabetogenic, white rice is diabetogenic, and you know, common things that we advise in pregnancy.
Becoming healthier, healthy diet and lifestyle.
Exercising, good diet and
sleep.
Sleep, yes. Be happy.
Yeah, be happy. Great. Someone is asking me if personal questions about you. They want to know if you have any hidden talents, and they're trying to, I guess, change the subject from this heavy topic. Hidden talents, Dr. Ferrazzi.
What you mean? What I like to do?
Yeah. Yes.
Well, when I was young, I was fancying to become a painter.
Oh, wow.
So now, then I moved to photographs. Then I moved to ultrasound. And I take pictures. I love take pictures with these, you know, things like this, and you can get really beautiful.
Wow, wonderful. So you're an artist at heart.
Yes, I like
doctor, the art and science of life.
After I finished to study at 11, I spent 1 hour, you know, working with my photograph.
Beautiful. Let me just see. I don't think I have too many more questions. So you haven't had to use any of these drugs that they're researching now on any of these pregnant females, remdesivir?
The protocol we are using in every area is comparing different protocols. So in Milano, we are using chloroquine, hydrochloroquine in pregnancy.
Okay.
Because they prove that the antiretroviral drugs otherwise used for HIV are not useful for this condition, and sometimes the collateral effects are so bad that they've been abandoned. So we are using hydrochloroquine, and other places are using different drugs.
So here we have patients that have lupus that are already on Plaquenil. So if they become pregnant, you just have them continue.
A contraindication in pregnancy, yes.
Right. Okay. All right. I think that is it for me. Thank you so much for your time. Is there anything else you'd like to share with a country that we're still, they say, a little behind Italy, you know, because I think it exploded so quickly there. And we were sort of in denial at the beginning. Even me as a doctor, I thought everyone was exaggerating. In January, I thought this was just another virus. But we saw quickly how it actually wasn't, and it isn't. So we're...
I hope that the United States are not hit that bad, because you have the obesity epidemics, and I'm afraid that the people will suffer most of this respiratory distress syndrome. So good luck.
Yes, yes. Thank you for publishing that. I look forward to reading it, and hopefully maybe I can check in with you in a month and see if there's been any updates.
We hope so. Thank you.
Yes, thank you very much. Grazie mille.
Arrivederci.
Arrivederci.